Greetings, this is Dr. Arun, consultant nephrologist from Bangalore. I have the pleasure today to discuss a few points about edema in chronic kidney disease. Kidney, as most of you are aware, is a pair of important organs that clean the blood out, keep the internal environment working, and to achieve this, it throws out the waste that are produced in the body. As a part of this, it also has to control the amount of fluid that is retained in the body as well as throw out the extra fluid present in the body. Chronic kidney disease is a term which has come to the fore in the last 10 to 15 years, and it was a major change that was made to remove the old terminology of chronic renal failure. Nobody likes to hear the term failure, and even a 5% reduction in function used to be called failure. So that was a major change that has occurred in this century. The other important change in definition has been our limitation of the term chronic kidney disease only to the function of the kidney with reference to serum creatinine. Serum creatinine, as we know, is not a great marker and is highly variable. We have also realized that by the time you see changes in serum creatinine, a large amount of kidney function would be lost. So we have also started looking at urinary abnormalities, of sonological abnormalities, of radiological abnormalities, and pathological abnormalities, and all of them have been clubbed together to be called as chronic kidney disease. And the other part of chronic kidney disease is even with a normal so-called kidney function, that is a normal creatinine, we can have a significant loss of function if the patient is losing protein, the term we use as nephrotic syndrome. These patients, the primary presentation would be the onset of edema. Similarly, in other conditions where there is reduction of kidney function, once the kidney is unable to throw out the extra water that is needed to be thrown out, there is accumulation of fluid in the body, which we call as edema. It is also worsened by the presence of secondary causes like infection or other comorbid factors like presence of cardiac failure and sometimes the use of drugs. So edema can be a major manifestation in any form of kidney disease and is always agonizing to the patient. For that matter, many elderly people believe that the onset of edema is the onset of end time for most of them. So it's a very distressing symptom and it has to be corrected. The treatment of edema includes the control of fluid intake, the control of salt intake. Salt and water always go together. So control of salt and water intake, reducing the load on the heart by reducing the blood pressure are the important steps you can take to correct the edema. Of course, it may not be possible without non-pharmacological means, and you may have to add on medicines in which diuretics are the most important contributors to reduce the edema. We have a huge gamut of diuretics now available and are useful. Of course, the other things like postural edema you can control by elevating the foot end, or also you can use some stockings to reduce the edema symptomatically. But overall, it is removal of the fluid, getting a negative balance, limiting the fluid, controlling your salt, using diuretics is how you can control the edema. So let us do our best to reduce this distressing symptom and keep our kidneys functioning. Thank you very much.